Well, meanwhile, sexual assault nurse examiners have extensive training in how to care for assault survivors and collect evidence for possible criminal prosecution. But forensic nurses say survivors who live in a rural area might not have access to the same care as somebody in a city. Elizabeth Ruiz shares with us how telehealth services are expanding to sparsely populated places around the country.
As if sexual assault isn't traumatic enough, imagine having to drive hours to get treatment. That can sometimes be the case for people who live in rural areas, but that is changing thanks to advanced technology.
We literally are filling people's scalps. We're looking inside of their ears. We're doing a really good assessment of their eyes, looking in every single direction.
Amanda Shelley is a forensic nurse who examines survivors of sexual assault.
You know, what are the other things that we can do to kind of help?
She works in Eagle County, Colorado, deep in the Rocky Mountains.
When we get a call from a patient that's coming in, we call telehealth right away. If we don't have any technical issues, right?
A program called Telesane was brought to Eagle County in May of 2021.
We're in such a rural community that we don't see thousands of patients a year. And so this really just gives our providers and our nurses that second set of eyes.
With the survivor's consent, they connect with a second medical professional via a private video chat. The collaboration and access to advanced technology allows victims to have the same access to resources as patients in urban areas. Before, survivors in this rural county had to travel hours down a mountain pass to get the care they needed.
Either they didn't have transportation or they were worried about the roads, and the time commitment to go over an hour out of the county was a real challenge for most people. And what we were seeing is that if we weren't ready to help them get the services in that time, sometimes they would lose their either motivation or they wouldn't have time to address it later.
Holly Casper Blank connects people with the Bright Future Foundation, which provides health services specially geared toward victims of trauma. The foundation is a partner in the Telesane program.
We have our emergency shelter. We serve about 30 families a year. Sometimes people stay involved with our behavioral health services for up to 2 years at least.
According to the International Association of Forensic Nurses, studies show there's a nationwide shortage of sexual assault nurse examiners, especially in rural areas. President Joe Biden recently signed a bill that provides $30 million to expand SANE services to rural, tribal, and other underserved communities. If you live in a rural area that still doesn't have SANE services, Holly suggests you pursue collaboration.
And it takes a village, and really considering who should be at the table. I think we're continuing to figure out how we can best help survivors and who else can help be here with us.
Elizabeth Ruiz, Scripps News, Eagle County, Colorado.